Hi, it's Jackie again. I'm going to show you guys some of our rescues this time. This is Rescue 71. It was put into service brand new about a month ago. We also do have two backup rescues. One is staffed as a jump truck between engine 72 if we need a third ambulance, and then we have a backup ambulance if one of our frontline goes down. Inside of the cab, we have a seat for obviously the driver and the passenger. Whoever's driving is going to drive that entire day, and whoever's in the passenger seat is in charge of teching for our medical calls. So they're going to be doing all of the computer work. They're going to be riding in the back with the patient to the hospital, and they're kind of in charge making all of the decisions. All of our lights and sirens can be controlled from the passenger seat, and then we have a computer that gives us our computer-aided dispatch just like in our engines, and then we do all of our EMS paperwork on that computer from the passenger seat as well. Some of the differences between this truck and the Rescue 72 are these compartments where we keep all of our gear are just a little bit bigger, configured a little bit differently. If you are assigned to the rescue, you are going to be the ones going in and fighting the fire. You are the first ones in on the line doing all of the interior work, while the engine crew is engineering, getting water supply, and then the officers are going to be incident command. So we keep all of our gear in these compartments set up, ready to go for easy deployment. We carry an SCBA for each person with backup bottles. We've got hand tools, we've got lights on each side, and then our SCBAs now come with a built-in thermal imaging camera right in the pack, so we don't have to carry those in, it's just on our chest. We have some other compartments. We carry fire extinguishers. We have a regular fire extinguisher, ABC Chem, and then we have a water extinguisher as well. And then just some various other salts because it's winter, tape if we get sent on down lines, so we can tape off the area. These back compartments are kind of where we carry extra equipment that we don't necessarily need in the back of the ambulance, but we might need to carry into the house. So we have an airway bag that we take in on any difficulty breathing calls, cardiac arrests, overdoses, anywhere where we might need to manage an airway inside of a scene. We also have the technology. This is our Easy IO. So if we are unable to get IV access on a patient, we will bring this out, and it is a little drill that we can use to get access through the bone. So in the middle of your bone is a void space that carries bone marrow, and that's where blood is created. And so we can access that space, inject fluids, medications, and then that goes through the cardiovascular system just like a vein would. So we typically reserve this for patients that are in cardiac arrest. It is a little bit painful for those who are awake, but it is a choice that we have if we're unable to get IV access. We carry a pediatric bag which carries all of the pediatric ET tubes, IV needles, pulse ox probes that are smaller for smaller fingers, and it's all divided into color-coded pouches that have the right size for the right weight or height of a child. Takes the guesswork out of it. We figure out what size they are, what color that coordinates to, and then we can just grab that pack. There's no guesswork. It makes it kind of foolproof for us. This is a big deal for us. This is called the Lucas device. This is a manual CPR. So we will put this onto a patient in cardiac arrest, and it will do the compressions for us, and it keeps it at a steady rate, and it keeps it at a steady depth. So this is a great CPR, way better than a human can do, and it frees up some hands to manage airway, push medications, get IVs. The way this works is it straddles across the patient's body like this, and then this suction cup gets pulled down to the depth of their chest, and when you turn it on, it'll automatically start doing compressions. The suction cup suctions to their bare chest, and it also allows for it to pull the chest up as well as push down, and gives better CPR with full recoil, allowing that heart to fill back up with blood and oxygen. This cabinet over here is where we keep all of our backboards, any cervical collar straps that we would need to secure a patient to the backboard if there was any spinal trauma that we were concerned about. It's also where our main oxygen tank is. So we have some portable ones that we take into the houses and on the stretcher, but this main one has inlets inside the ambulance and gives us a greater reservoir for oxygen if we need it. This is our stair chair. This is a super helpful tool if we have a patient upstairs that's unable to walk downstairs. We can put them in this chair, strap them in, and then these tracks allow us to just easily slide them down the stairs. So it's a one-way track, only goes downstairs, but if we need to carry up as well, there's handles up here and at the foot so we can easily pick it up. And then it rolls around kind of like a wheelchair. This is the same cabinet that we have on the other side, but for whoever is riding in the passenger or tech seat. A couple different tool options, and then we do have a thermal imaging camera for the person on this side that they can bring in. And then we'll go check out the inside. So we're really fortunate here in Madison Heights. We have the Stryker Power Pro 2 cot in the power load system. So they're a hydraulic load and cot, a back saver. We're super fortunate to have it. It comes out and lifts up hydraulically, and then the wheels drop or raise with the push of a button. So this cot will slide into the load system, and that load system will put it into the rescue with just one button and one finger. And then if we're going to take it out, it unclicks, slides out, and then it can be lowered or raised with the buttons here. If we need to lower it down to the level of a patient, it's for them to easier get on and off of it. And then it raises back up as well. As paramedics, we do cardiac monitoring, EKGs, and 12 leads. We carry the LifePak 15, which is a very expensive and very fancy cardiac monitor. It can do a lot of things. It can take your blood pressure. It can take your pulse ox. We can do a 4-lead EKG with just 4 different views of the heart. We can also do a 12-lead EKG, which is a little bit more in-depth, and that's what typically is used to diagnose cardiac arrhythmias or determine if someone is having a heart attack. It can also do defibrillation if somebody is in cardiac arrest and is one of the rhythms that needs to be defibrillated. It can also do cardiac pacing, so if someone's heart is going too slow and we can't get it to beat faster, we can send electrical impulses to it to make it beat faster and at a rate that is going to be adequately perfusing the rest of their body. So it's pretty fancy, it does a lot of stuff, and we use it on pretty much almost every call. There we go. So this is our patient compartment. This is where anybody who is going to be transported to the hospital will be. Typically they'll be on our stretcher here, but we do have the capability to carry more patients if we need to. We have harnesses here that we can transport other patients who are a little maybe less critical. But you'll always have a paramedic, if not 2 back here, depending on the stability of the patient. We might have 1 or 2 paramedics back here on the way to the hospital just for an extra set of hands. But over here is typically where we have all of our bandaging stuff, easy access, and then this is going to be our IV cabinet. Anything we need to start an IV is going to come out of these 2 cabinets. One of the differences in this rescue is this mount for our monitor. Typically before that we would just have it on the back of the cot here or strapped into the bench seat. This is a new mount for it, it allows us to pivot, and it's a little bit safer and more secure, and reach that Lucas and that easy IO. If something were to go awry en route to the hospital, we have access to all of that equipment without stopping. Up here we have more bandaging stuff, we have some masks, we have glucometers if we need to check a blood glucose. Kind of anything that isn't typical as much is going to be in these two cabinets up here. OB kits if we need to deliver a baby, stuff like that, burn sheets. This is going to be all of our airway stuff. So as paramedics, we can not only just deliver oxygen, but we can intubate as well. We do CPAP if we have a patient who is awake and alert, having severe difficulty breathing, but isn't severe enough to need intubation. We have extra monitor paper, extra defib pads. We have the ability here to plug in different sensors into our LifePak 15 so we can monitor carbon monoxide levels. So these are special probes only for carbon monoxide that we would use if someone had been exposed to a carbon monoxide, just came out of a house fire and was exposed to smoke. Levels that we would want to monitor and kind of alter our treatment would be used for these special probes. And then back here is going to be all of our bag valve mask, intubation, anything that we need for a more advanced airway is going to be back here. As paramedics, we have the ability to administer a variety of medications, whether it be for cardiac needs, for respiratory needs, for an overdose, a diabetic problem. We have the ability to administer dextrose, IV IO. So we keep our drug box and our APAC locked up in this cabinet. The little bit of differences between the APAC and the drug box are what's in them. The APAC is typically used for a less severe call, so it doesn't have any cardiac meds, it doesn't have any pain meds in there, but it does have albuterol for breathing treatments, has dextrose for diabetic emergencies, it has Narcan if we have an overdose, and it has Zofran if we have someone who has nausea, vomiting. It has prednisone as well, which is a steroid that we would typically give someone later down the road if they're having difficulty breathing. The drug box carries a little bit more. It carries our narcotic pain meds. It carries any cardiac medications that we would need in the event of a cardiac arrest or an arrhythmia. It carries Benadryl, Solumedrol, things that we would need for an allergic reaction. And then it also carries everything that we have in the APAC. So kind of depending on what the call is for is which one we'll grab. In here we just kind of carry some biohazard bags, some PPE if we have like a messy call, and then we keep our cervical collars as well. So if anyone has suspected spinal trauma, we're going to put a cervical collar on their neck to help remind them not to move their neck until they can get to the hospital and get it x-rayed. We also have in a cabinet back here, we have our trauma bag that we would respond to any like mass casualty incident. So it'd be a shooting, it'd be a mass car accident, anything where there's going to be potential for a lot of trauma. We have a special bag that we carry that has tourniquets, it has decompression needles. If someone has a collapsed lung, we can use that to hopefully reinflate it. It has gauze with some packing agents in it to help clot any wounds that are there. So we have all of that already in a trauma bag as well. We also carry back here a autism sensory bag. We have it on all of our trucks that was donated by a Boy Scout here locally. Packed up some bags for each rescue and each engine that has some sensory items, that has a communication card if they're a nonverbal person, and then it has some toys and a stuffed animal to kind of ease their time with us, help us communicate with them and help them remain calm. And we also have a child restraint seat. So it buckles right into the cot here based on patient's weight. It's color coded, so we'll find out how much they weigh. It'll buckle right into the stretcher here, and then that gives us a much safer way to transport children rather than strapping them in here, having mom hold them, or even putting them in their car seat. Is a more safer way, but the child restraint that we have is the safest way, and it's required for any ALS ambulance in the state of Michigan. It was provided by the state. We have oxygen access on both sides here if we need to hook anyone up to oxygen or CPAP or give them a breathing treatment. And we have oxygen tanks here on the back of the stretcher, in bags, and then we have our main oxygen as well. I hope you enjoyed the tour and got to learn a bit about what we do here in Madison Heights and see some of the great equipment that the city provided for us.